I'm Taryn. I'll be the nurse practitioner student helping you out today. Trevor, what brings you in?
I have itchy runny nose and drainage and compression, or I guess pressure in my face and nose.
Okay. All right. Well, we'll hopefully get to the bottom of that today. Just going to start with some general questions. To start off, do you like to be referred to as Trevor? Or do you have a different preferred name?
Trevor is fine.
Okay. And what do you do for work, Trevor?
I work for an engineering company.
Okay. Do you like it?
It's a job.
Okay. Pays the bills?
Mm-hmm.
Okay. All right. And are you married, in a relationship, single?
Girlfriend?
Okay. And do you have any kids or pets?
None.
No. And do you live with anybody?
No.
Okay. And then what do you do for exercise if you do anything?
Pretty much just go to the gym, and then hunting or any of my hobbies is my exercise.
Okay. And so hunting's a hobby. What other hobbies do you have?
Skiing, golfing, rafting, just pretty much anything outside.
Okay. But you're in hunting season right now?
Mm-hmm.
Okay. What are you hunting for?
Elk.
Okay. Well, good luck.
Thank you.
All right. Any alcohol use?
A few a week.
Okay. And then any tobacco use?
No.
No. Any illicit or recreational drug use?
None.
No. Okay. Do you have any allergies?
None. No.
No allergies? Okay. Any medical problems that you're diagnosed with?
No.
No. And have you ever had surgery?
No, I have not.
No surgery. And do you take any medications?
No.
No medications? Okay. And then going on to your family history, anybody in your family have any significant medical history that they're diagnosed with?
No.
Okay. Any seasonal allergies or asthma diagnosed with any of them?
Not really, no.
No, not that you know of at least.
Mm-hmm.
Okay. Moving on to some more questions about why you're here. So you said that you have this nasal congestion, sinus pressure, runny nose, sometimes those itchy, watery eyes.
Sometimes not, yeah.
Okay. All right. And then when did all this start?
About 6 weeks ago.
Okay. And would you say that it's located just in your nose and eyes or anywhere else you're having the symptoms?
Just in my face.
Just in your face in general? Okay. All right. And would you say that this has been constant for the last 6 weeks or does it come and go?
Comes and goes. It's definitely worse outside.
Okay. And how would you describe the pressure congestion that you're feeling?
It's from my nose where I just can't breathe because of congestion, and then just my whole face to my ears hurts because of pressure.
Okay.
And I can't relieve it.
Okay. I'm sorry. That sounds rough.
Mm-hmm.
Okay. And how would you describe the drainage?
It's clear, thin, inconsistent. It's either 100% just flowing like crazy or it's nothing. There's no in between.
Okay. And does anything make these symptoms worse other than being outside?
Not really, no.
No. Okay. And then does anything make these symptoms better?
Not really, no.
No. Just fairly constant.
Mm-hmm.
Okay. And have you tried anything?
I mean, I've been taking over-the-counter allergy meds, flu and cold symptoms, nasal sprays, pretty much anything I can get over-the-counter. It's just not really doing anything.
Okay. Well, I'm sorry I haven't had success for that. Like your Claritin and Zyrtec, is that what you're doing?
Yeah.
Maybe some Afrin nasal spray?
Mm-hmm.
Okay. Okay. And then timing of day, do you notice that there's any difference between day or night of symptoms getting better or worse?
Not really. Just I know it gets worse when I try to go to bed.
Okay.
I don't know why it does.
Okay. And on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain, what would you rate your pain right now?
0 to 1.
Okay, so not in much pain right now. How would you say that these symptoms in general, though, have been affecting your life?
It's just really annoying, especially during hunting.
Okay, yeah. All right, so moving on to some more just kind of body system questions. A lot of them are going to be yes or no. So have you had any fevers, chills, fatigue?
Not really, no.
No? Okay. What about trouble sleeping? You said that these symptoms are worse at night.
I it's annoying to sleep with, like a runny nose or my pressurized ears and face. It makes sleeping hard.
Okay, I'm sorry about that. Any itchy or watery eyes?
Not really. It seems like I'm just crying from sneezing.
Okay, any pain in your eyes?
No.
Okay, and you talked about the nasal congestion, the drainage, some pain in your sinuses, any bloody noses?
No.
No. Okay. Any sore, scratchy throat?
No.
No. And any trouble swallowing or loss of taste?
No.
No. Okay. What about any problems with ringing in your ears or loss of hearing?
No.
Any pain in your ears?
Only when they're pressurized.
Okay. But no current pain? No. Okay. Have you noticed any swollen lymph nodes in your neck?
No.
No. Any trouble breathing or feel like you can't do your normal day-to-day things?
No.
Okay. Any cough or chest pain?
No.
No. Okay. All right. Now we'll move on to a physical assessment. I'll just explain everything as I'm doing it here. We're going to start by taking your vital signs. So just going to feel your pulse here. We'll take your blood pressure. Then I'll do your respiratory rate, temperature, and then you said your pain's like a 0.
Correct.
Or 1. Okay. All right, and then moving on to your eyes. So your eyes are symmetrical, irises are brown, and your sclera are white. Hair on eyebrows and eyelashes are evenly distributed. And I'm going to use my pen light here. You don't have to look at it, but I am going to shine the light in your eyes. You can just look behind me, just checking out your pupils. Okay, and then the other side. Alright, and then just follow my pen light here with your eyes. Okay, so pupils are equally round, reactive to light and accommodation. And then I'm just going to palpate kind of around your eyes. Let me know if there's any pain. Any pain there?
No.
No. Okay, just going to palpate your sinuses while I'm here. Any pain in those sinuses?
No.
Okay, not currently. Okay. Moving on to your nose. So nose appears midline. Doesn't appear like there's any drainage, redness externally. And then I'll just have you look up to the ceiling here. I'm going to shine my light again if you want to close your eyes. So septum is midline and no deviated septum. Hair is evenly distributed. There is some redness and swelling in those nasal terminates and mucosa, but you do have patent nasal passages. And then we'll move on to your mouth. So I'll have you open up your mouth for me. So mucosa are pink and moist. Teeth are intact. There's no missing or broken teeth. Will you stick out your tongue for me? Tongue is midline and then say ah.
Ah.
Okay. Uvula raise with that, and tonsils are +1. I don't see any edema or redness or any white spots in the back of your throat there. So then we'll go on to your ears. I'm just going to look externally and then we'll look inside of them. So there's no redness or swelling externally. Is there any pain when I palpate here?
No.
Okay. And then we'll just look inside here. So just going to pull that ear up and back. So tympanic membranes, that pearly gray, see the cone of light as well. And then we'll go in and look at this other side. So any pain when I palpate here?
No.
Okay. And no edema or redness externally. I'm going to pull up and back to look inside as well. Okay. And then hair on that side is evenly distributed. Do you see the tympanic membrane, that pearly gray with the cone of light as well? So moving on, we'll palpate your neck. just palpating those lymph nodes. Let me know if there's any pain with it, okay? So we're gonna start occipital, postauricular, preauricular, your tonsillar, submaxillary, submental, and then superficial clavicular, posterior clavicular, and then deep cervical chain. Okay, any pain with any of that palpation?
No.
No, okay. So I did not feel any swollen lymph nodes with that either. Just to kind of conclude what we did today, so you came in for some nasal congestion, kind of congestion of your whole face when it does happen. It's worse when it's outside. You have watery eyes, runny nose, you're sneezing, and it gets worse at night too.
Mm-hmm.
You've tried all these over-the-counter medications, they haven't worked.
Mm-hmm.
So what this sounds like it may be allergies that's causing this allergic rhinitis, as we call it. What I can do is I can prescribe a glucocorticoid or glucosteroid, a corticosteroid and antihistamine combined into one nasal spray, and you can take that. That should give you some symptom relief. If you want to, you can still take your over-the-counter allergy meds as prescribed, but to be most successful with this spray, I want you to use a saline spray before, just to help moisten up those mucous membranes. So don't want you to tilt your head back when you're using the spray. Keep your head neutral. Just close one nose hole, spray it up as you're taking in a breath, then do it to the other side. Wait about 15 minutes, then use that prescription spray. And then that should help you out. If it's not working in a week, come back and see me, or if your symptoms get worse, come back and we can try to see what else we can do for you.
Okay, sounds good.
Do you have any questions for me?
I don't.
Okay. All right. Well, good luck hunting. It was nice to meet you.
Thank you.